This is Chapter 1 from the Patient Education: A Practical Approach book. As you can see, we're going to start this PowerPoint and all subsequent lessons with a picture of the textbook cover so that you know that you're working from the right book. This is a sample Train the Trainer assessment form. It would be used to determine if a presentation given to, for example, patients about a disease process was adequate. Was it entertaining? Was it culturally appropriate, age appropriate, things like that. And so an assessment form like this is going to be similar to how we will all judge one another as you present demonstrations throughout the course of this class. We're going to begin by learning how best to create educational presentations for patients. Now, the other textbook you have is more geared towards teaching other healthcare professionals. And so this one is really focused on how to educate patients, and there's a huge difference. We're going to go back and forth between the two throughout this class. It's important that you remain really excited, or at least upbeat and positive, when you provide an educational message to patients. Sometimes they're really down in the dumps, and it can be really hard to give them a good positive presentation if you know, for example, that they are facing certain death. You have to make them want to live longer and better and healthier. It can be pretty challenging. So if there's a day when you're just really not up to this, see if you can pass it on to somebody else, because the harder ones, especially when you deal with children, or sometimes there are particularly emotional situations, you really got to put all you've got into making a good, high quality presentation. You have to also make sure that you communicate with the patient in a way that they understand. So, for example, when you ask them what medications they're on, if they don't remember, you can prompt them, but don't give them answers, otherwise you'll wind up with a list that you created from your own head. I had a patient once, used to come into Valley all the time. He told us that albuterol would kill him, but he could take Ventolin anytime. Maybe it was the other way around. Either way, you just had to go with it, and it's kind of funny, but the man was really serious. So rather than argue with him and point out that they were the same drugs, it was easier to just go with it, because as long as you were giving him the drug that he wanted to take, then he would gladly take it and take it well. So sometimes you have to be a little creative, or at least ignore the obvious, in order to give the patient the best possible experience. As you educate patients about their specific disease processes, you make sure that you are not lying to them under any circumstances. I mean, if they're going to die from whatever disease they're suffering from, don't lie to them and tell them there's hope. Tell them that you can assist in helping them learn how to make their life better, the quality of life. You can't give them more time, but you can help give them better time. And make sure that you stay up to date on current technologies and advancements, so that if there's something new you can offer a patient, then go ahead and do it. There's new and impressive advancements taking place every day. It's important to stay on top of that. There are a lot of different websites and mailing lists you can get on to help you with this, and if you want a list of these, let me know. As a patient educator, it is your responsibility to be able to offer patients various options when it comes to their treatment, as many as possible. Now, obviously, you can't prescribe drugs or specific therapies to people. You may be able to recommend them to their physician, but if a patient is not doing well with one particular therapy, then feel free, please, go talk to their doctor about what you think might be better. And not everybody can tolerate CPAP, but people who don't tolerate CPAP well may very well benefit from BiPAP. So sometimes it's really simple to to find a better option, switching from an SVN to an MDI, for example. There are constant changes in medical technology and understanding diseases. Since the human genome was cracked, we're finding, on and on, we're finding genes and responsible bits of DNA that we might be able to offer gene therapy for in the future. I think one of the first diseases we're really going to find substantial real treatment for will be cystic fibrosis. Of course, that's in our wheelhouse. We're really fortunate in that some of the diseases that I think will either be cured or substantially treated first are probably respiratory diseases. So in a way it's exciting. In another way it means that you have to keep up with that much more information so that you can have that for patients. Make sure that you don't overstep your bounds though legally and give medical advice that you are not legally able to give. So be careful there. And since the Affordable Care Act passed, it's not mentioned in your book, but I think it's important to add to this list that patients who in the past may not have been covered by any insurance are very likely to be eligible for insurance. Especially in Nevada, we were very fortunate to have Medicaid expansion when a lot of other states didn't have that. And so, make sure that you can point patients to social services that may be of benefit to them. It's well documented that the more control people have over their lives and over their medication and their health, the happier they are generally. They suffer from less depression, and they're more likely to be compliant with their medications and therapies. So work hard to get these people actively involved in the educational process when it comes to their diseases. That varies. If you're dealing with children, it's certainly different than adults or elderly patients. And if there are family members who are caregivers involved, make sure that they are at every possible educational opportunity that you offer. So make sure that you train parents or train caregivers at the same time, or at least separate but equal, you will, as you do with the patient. All right, so what happens when you do one of these educational opportunities? The first thing you have to do is make the patient feel comfortable. But before you ever walk into the room, you need to have gathered a lot of information. You need to know what's wrong with the patient. You need to know what their social situation is, if there are caregivers involved, if they have or need insurance, for example. And if they're blind or deaf, you may need to take an interpreter or speak a foreign language. So make sure that you have everything you need to communicate well with the patient. Make sure that you also have all the possible up-to-date information that you take with you so that you can answer as many questions as possible. I think really quickly we will see iPads used in a clinical setting for this type of thing. I know they're being used for other medical options, but that's going to be the way to go. You can download all different types of information for all kinds of different conditions, and then at the touch of a screen you can have it right there. You can use interactive videos or straight up pieces of paper. Just make sure that you have with you the technology and or various media that you need. And then when you walk in, act like you know what you're doing. It makes a huge difference. If you walk in meek and you won't look the patient in the eye, then they are not going to trust you and they're not going to believe a word you say. You have to watch yourself when you look at the things on this particular slide. There are certain things you are legally not allowed to do as a respiratory therapist. You can pass on a diagnosis if the patient has already been given that diagnosis by a medical doctor. So if the doctor's already said, sir, you have lung cancer, then you can walk in afterwards and say, hey, dude, look, you got lung cancer. You don't want to be the one to spring the surprise on these people. There's a lot of legal responsibility that goes with being the first person to tell someone about a diagnosis, so don't fall into that trap. If someone has a new onset diagnosis, be sure that that someone else has already broken this news to your patient. That aside, if a patient wants to discuss lab results that a doctor may have already mentioned to them, then if that is in your purview, feel free to do that. But again, make sure that if there's anything important, any really important diagnostic lab tests, that a doctor has already gone over it before you get in there. That's quite possible the doctor sat down and used a lot of big words and the patient truly didn't understand what they were saying, or as is the case in Las Vegas, it's possible that the patient couldn't understand the physician's accent. So it's no problem at all for you to go back over things with the patient and explain it to them in a different way. Okay, let's say you have your dream job. You work in some pulmonary lab where the doctor gives you free rein to help prepare treatment plans for patients. That would be really great, wouldn't it? And there are a few places out there that allow you to do that. Well, the first thing you have to do is sit down with the patient and decide what goals you want. If the patient helps you set the goals and you don't just walk in and hand them to them, they're more likely to be engaged and actively attempting to make those goals happen. Then come up with a complete plan, not just a little bit here and a little bit there. You want to talk about medications, you want to talk about lifestyle changes. I mean, do they need to rip all the carpets out of their house? Do they need to move to a new city? These are things that are really important, and some of them are big life-changing decisions. Some of them are really small. You need to just change pillows. That's pretty easy. But explaining to the patient why these changes are helpful and allowing them to make informed decisions will make them more likely to be compliant with the game plan. Make sure you let them know what side effects or complications of medications are going to be, things to expect. You know, I think when you were in regular CRS classes and you were learning to give breathing treatments, we really harped on the fact that you should tell people the first time they have albuterol, it's likely to make them shaky. If you don't tell someone little things like that, then when they do get shaky, they're more likely to say, oh, I don't like that, and never take it again. Well, this certainly limits your treatment options later. So telling them ahead of time, these are the things to expect, this is what's normal, this is what's abnormal, will again help them be more compliant with their treatment plan. And then later on, make sure you do follow-ups at regular intervals. Maybe 1 month at the beginning, and then go 2 or 3 months, and then another follow-up at 6 months, a follow-up at a year, to make sure, number one, that the patient is being compliant and that they understand how to do everything correctly, but they also need to know what they have to report back to you so that you know everything's being successfully worked. So let them know what you need, what they need to document and bring back with them, and everybody's life will be easier. I'm sure you learned this stuff in Communication 101 class. Make sure that as you talk to patients, they can repeat what you told them, or at least explain it back to you, so you can verify that they understand what you have said to them and what your true meaning is. Allow them to ask questions, obviously. Communication is two-way here. And use every conceivable opportunity to make sure that the patient understands their disease. Make sure you schedule your follow-up and any other rehabilitation services the patient might need. And while you're at it, make sure that the patient is living in a good, solid home environment, or they're being cared for appropriately. If you see any type of abuse, whether it's elder abuse or abuse of a child or anybody, domestic abuse, it is your legal obligation to report that to social workers and the police. So keep that in mind and really assess the best possible living situation for your patient. Again, back to Communication 101, make sure that you understand everything the patient is saying to you and every question they ask. If you are unsure of the question they're asking, ask them again. Ask them to repeat the question using different words. Make sure you use appropriate vocabulary for the patient you're dealing with. If the patient does not speak English as a first language, but they do speak some English, you'll have to decide whether you need to get an interpreter or whether they understand enough for you to send them home safely. If there are any specific religious or financial needs or just different cultural distinctions that you need to note, then keep that in mind. Sometimes there's not much for us to do about these cultural differences. They're just things to note and notice. There's a story about an Amish child who went home on a ventilator, and the family didn't have electricity. They got permission from their church to put electricity into one room, but then they still wanted to use their open flame lanterns next to the oxygen cylinders. And so education in that case and providing for the social needs for that patient were imperative. And the respiratory therapists who tell this story had to actually go to the elder council and explain why the family needed electric lights in that room as opposed to open flame. So sometimes there are things for us to be actively involved in, and other times it's just interesting. I also had another dealing with an Amish family, and they just wanted to come in and sing to their child while he was in the pediatric unit in the hospital. So nothing for us to do except listen. It was a wonderful experience, but keep that in mind. Pace your educational opportunity well. So don't go too fast. Don't look like you have to run out of the room quickly. Don't act like you have somewhere else you'd rather be. Because the fact is, you have to make these patients feel like they are the most important people in the world to you right that moment. The more important they feel, the more they'll listen to you. Be professional. Make sure you brush your hair and brush your teeth before you walk in. And watch your nonverbal communication. So don't stand in a closed-off way, or make sure that your nonverbal body language is very open to your patients. There are a lot of support groups. There's support groups for just about everything now. So find support groups that your patient may be interested in and offer it to them. Make sure that if you talk to other patients that you don't violate HIPAA. But certainly if a patient, particularly if they have an unusual diagnosis or a new onset of a really serious condition, it's often helpful to find a buddy, a partner for them who also has this condition, who's lived with it for a while, and to use that person as a mentor more than anything else. It's very useful and has been highly successful in various educational settings to put these people together, to find a mentor and a mentee, if you will. So if you have one patient who is being particularly successful at, for example, controlling their COPD, and you've got another patient who has a lot of potential but doing a good job with their COPD, maybe you can hook these two people up so that the first patient can help the second patient. Make sure you have everyone's permission, again, so you do not violate HIPAA. The longer you do this, the better you will get at it. Make sure that you represent material to the patient more than once. That's why the follow-ups are so important. Give supplemental education materials, give them websites and other resources, support groups, things like that, so that they can inform themselves on their own. Also caution them when it comes to the internet in particular to not go to quacky, crazy websites. Make sure that they're spending their time on high-quality websites. It's really frustrating when a patient comes in and says, I'm going to stop using this medication that works really well because I read on the internet it can turn me blue or make my toes fall off. You know, people read things, and if they're gullible or desperate enough, they'll believe them. And you know, a lot of people don't want to be stuck on medication for the rest of their life or have to change their lifestyle. If someone offers them a silver bullet that will take care of all of their problems, and it's something they can buy off the internet for $19.95, why wouldn't they buy this magic cure? I'd buy the magic beans too. But you got to make sure that the patients understand that that's exactly what those things are. They're a hoax. So try to educate your patients on becoming savvy readers and being able to tease apart good, accurate medical information and quackery. And then in the end, watch your religious discussions. You may be extremely religious and feel one way about something, your patient may feel the opposite, or vice versa. Just stay away from those things if at all possible, especially when it comes to dealing with children or neonates or the elderly. End-of-life decisions can be really sticky. Be honest with people. If their loved one is not going to lead a healthy, productive life ever again, tell them that. Then don't pressure them into making any religious decisions that they are not ready for. We had a baby in the nursery once whose parents were Hasidic Jews, and it was really important to them that they circumcise their son as soon as possible. And they actually would not tell us his name until he was circumcised. Unfortunately, he was extremely sick, and we knew he was going to die, but they did manage to get him home long enough for his bris. And he lived about 5 days at home before he came back and died. But during that 5 days, they were able to have his bris and do the circumcision and name him, have a naming ceremony, and it meant a lot to these parents. And it meant his eternal salvation, you know. This was important to them. So rather than saying, hey, man, you shouldn't take this child out of the hospital, you certainly should cut him up in a non-sterile environment in front of a group of people who are eating crudité. You know, the fact is that's what they needed to do for their own peace of mind, and it was their decision. So just go with it. When at all possible, just go with it. But be honest. Whenever possible, make sure you involve patients, caregivers, and significant others to help your patients learn how to best take care of themselves. If there are any sensitive issues you need to raise with your patient, for example, maybe you don't know what gender your patient is and you need to ask, do it tactfully, and if you can get away with that one, I would ask a nurse. Get someone else to ask. Watch out for emotional responses. If someone is exceptionally emotional, then you need to decide if this is just because they're tired, frustrated, and just plain sick, or is there a mental illness that needs to be dealt with. Whatever, you need to decide if the emotional response is at the right level for what you're discussing with the patient. If the patient's really upset, so upset that they can't listen to you, they can't follow what you're saying, they're not going to remember what you're saying, then continuing on with the education at that point is fruitless. So you might as well just call it a day and reschedule another time when they're not as emotional and you can have a better interaction with them completely. Then at the same time, or when you're finished with your patient, I should say, then make sure you ask them to not only repeat what you've taught them, but ask if they have any other questions for you. Don't let them leave in a frustrated state. That doesn't do well for your reputation, and future interactions won't go as well because they had initial interaction that wasn't positive. If you don't know what's going on, there's some question they ask you that you honestly cannot answer, tell them I don't know, and as everybody always says, make sure you get back to them. But this is really, really, really important, particularly when you need them to trust you for their needs, their education later on. If you don't establish a good, solid, trustful relationship with these people at the beginning, you'll never get them back. As I've stated, there are a lot of different factors that influence how well a patient accepts education. And so keep all that in mind, and there are probably a million other things we could add to this list, but know that you can't plan for every possible scenario. As you work, you will develop your own methods for coming up with proper training and education for your patients, and that's great. That's the way it should be. This is just one model. This is just one way of doing things. It is a nice compressed model in that it includes all the pieces that you need, so it's a good place to start. But no two educational processes will ever be the same. Don't expect them to be. So we have recognized the importance of patient education in managing patient health conditions. We have talked about different techniques we can use in the communication/interview process so that we can effectively educate and motivate patients to be active pursuers of healthcare. We've talked about how to help patients become better self-educated, make sure that the patients ask you questions, And remember, no absolutes unless you are positive. Bottom line here is that you need to make sure that your patients understand they're not alone, that you are an advocate for them as they are an advocate for themselves, that you'll help them learn how to have the best possible life in their situation, and that if they have any issues, questions, concerns, problems with their medication or their treatment, that they can come to you and you will help them find the answers. Also, let them know that if they have a cultural change or something different than what you're used to, that you're willing to work with them, that their culture is important to you, their language is important, their beliefs are important, and they'll be more receptive to you and more responsive to the things that you offer them. Bottom line, create a very positive environment. If you can't do that, find someone else who can, and do the best you can to give the patient as much information as possible all the time.